Dr. Morse, my dad Thomas is age 84 years old, has asthma. Okay, so first thing, asthma, neurological, adrenal glands. First thing, asthma is the first part of COPD, chronic obstructive pulmonary disease. First phase, you got asthma, emphysema, the actual what they call COPD, which all of them are part of the COPD chain. So you know that. He's got afibrillation, atrial fibrillation, meaning his atrials, which is the top chambers on your heart. The smaller chambers, blood goes in there, all right, first, and then to the ventricles. That atrium is fibrillating. There's flutter and there's fibrillating. Fibrillating is better than fluttering. It depends how many beats, electrical beats. Generally, one beat comes from the sinus SA node, from the atriums, that opens up the mitral valve or tricuspid. Blood then flows down from the atrials to the ventricles, and then you have that movement to the lungs to get oxygen in, back to the left side, and same thing, and then back to the body again. So this is, again, you see AFib with adrenal glands. Now, here's another thought with AFib, though, is calcium channels. So you want to look at the parathyroid of your dad here. At 84, it wouldn't hurt to pop up his parathyroid gland in the first way. Duodenal ulcer. So you're either looking at a pancreatic problem where he's not producing enough bicarbonate, and these proteins are burning him, or the hydrochloric acid is burning him, or it's interstitial lymphatic constipation, which is the worst one. Remember, we talked about that. If it is the pancreas, first of all, stop all protein on an 84-year-old. And an 84-year-old should never have protein because they're too old to deal with it. The kidneys on these guys are down, prostates are down, all these things are down. They need to live on raw foods as much as possible. Fruits, berries, and melons. Energize the brain, turn on the nervous system, clean the kidneys, prostate, revitalize an 84-year-old. Because at 84, he's got to have some partly good genes. And you can go in and refurbish this 84-year-old man here and fix all these things. Going to the high blood pressure, of course, there's your kidney connection. And of course, that's going to go back to the asthma with the adrenals, and blah, 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 blah. He takes albuterol to breathe. Now, the problem with albuterols and all these inhalers, cancer-causing, you can't suppress. Use herbal antispasmodics to relax the nerve. That's the nervous system side of this. He's spasming. Get that parathyroid up, because there's a parathyroid involvement when he has a thyroid involvement. And so he's had radioactive icicle. Oh, these guys just don't know how to stop. This is Little Miss 40. Hello, Little Miss 40. Her father had COPD. We addressed that in a previous thing. Yeah, I understand why you did the N-acetyl crystalline. I do know why you did that. This is on the COPD with her dad. The antispasmodic, definitely to keep him breathing. You don't, inhalers suppress cancer causing. That I'm just repeating what articles I saw in newspapers about this. So also lungs number 2 would be good. Either one, but lungs 2 is a little more of an expectorant in terms of breaking up hardened mucus. 3 lung tea, great for hardened mucus in the sinuses or the lungs. Just 3 herbs in there, 3 lung tea. Always kidneys, dear. Use kidney 1 capsules, kidney number 2 liquid. Go after your dad's kidneys, and you always go after his adrenal, any neurological problem. People don't realize that even though we're talking about lungs, the lungs are able to function because of what? The nervous system, and that nervous system is the autonomic, sympathetic, parasympathetic. Got to go after the adrenal glands. Have to go after the adrenal glands. And the GI tract, because your sympathetic and parasympathetic combine in the gut area. And that's where a lot of people have problem, is the gut, the transverse bowel, the stomach. There's a 25-year-old male. I'm suffering from chronic asthma. All right. Okay, so here's the thing, man. Let's see, who is this? Oh, I can't pronounce your name. Faisal. All right. So here's the thing. Here's a 25-year-old male that's suffering from chronic asthma. So right off the top of my head, antispasmodics. Excellent for controlling this. Inhalers, cancer causing. So always have them there for yourself, but use an herbal antispasmodic. It relaxes the bronchioles, it relaxes the lungs, and allows you to expectorate. At the same time, you're going into those adrenal glands because every asthmatic that's the beginning of what we call COPD, chronic obstructive pulmonary disease. The asthma is the beginning stage of these are neurological events along with congestion in the lung, both aspects. So you're going to detoxify mucus and stuff out of your lungs, but you must strengthen the nervous system to do that. And that is an adrenal experience. I'd use Brain and Nerve 2. That's a great one to help with that. But I would also enhance my adrenals with adrenal glandular. I'd get my kidneys filtering. Start pulling as much of this congestion down and out your kidneys as you can. At the same time, strengthen the autonomic to that. Clean up the GI tract since the stomach and the solar plexus, the nerve ganglia for all of this. So detoxify yourself in that way. Use the antispasmodic when you get tight. If you need to grab an inhaler, use an inhaler. Nebulizer, much better. Be careful with these inhalers. Very cancer causing. Tampa Tribune, big local newspaper here, wrote a huge story on these a lot of years ago. The cancer causing effects of inhalers. A steroid too. So the other problem is you must back up your adrenals because there you're going to lose your steroids. So you got to back up those adrenals. I would get adrenal glandular 400s and probably pop 1 or 2, 3 times a day because you're going to run some low blood pressure. Once you start fixing all this stuff, you're going to see some real low blood pressure here. What is the best way to get over asthma? I have been raw 3 months. Take oregano oil, lobelia marshmallow herb, and heel oil tea and castor oil pack. I am 61 years old. I have a long way to go. It takes 61 years to get this way. I went on a 48-hour water fast. It was good. I plan on a 7-day fast to clean me out. Thank you, Larry Z. Larry Z. Asthma isn't just a congestive condition of the lung like pneumonia. There is a neurological component to the COPDs. And asthma is the beginning stages of COPDs. And so always go to the adrenal glands. That's where it is. The autonomic nervous system. Get your adrenals up. Get your kidneys filtering. Also use lungs too. Start to clean out the lungs as well. But it's a neurological problem, Larry, and you've got to enhance that nervous system. You do that by increasing neurotransmitters. That means make your adrenals healthy, and the Brain and Nerve 2 will strengthen the nervous system as well. So you can go with the Brain and Nerve 2 if you want, or whatever one you want on the market. Get a good nerve strengthening formula. Get your adrenals up. Start cleaning your body out, and you'll be very successful, and you'll go way beyond asthma.
I would also look at maybe drinking some of the Heal-All and 3-Lung tea.
Good point. The 3-Lung tea, Larry. Add it with the Heal-All tea because the 3-Lung tea is more about breaking up hardened sputum or mucus. I also have a 12-year-old, oh my God. So listen to this. I also have a 12-year-old daughter who faints sometimes. Well, again, right back here, man, this is autonomic for you, and this is where you're seeing this. Remember, you were genetically compromised with kidney and adrenals, and your daughter is much more so. Same thing. Doesn't have to show itself as asthma. No, it doesn't have to. It can show itself as fainting. It can show itself as lightheadedness. It can show itself as meek and shy. It can show itself as major anxieties. That's the adrenals. So you've got some work on your daughter. Same formulas. It is especially when she gets out of a hot bath. Now listen to this. That is neurological, sweetheart, completely. When you take a neurological weakness and you put them into heat, you go down like this. We always in hospitals turn the room down. Everyone that is a COPD or likes their houses cold because that's alkaline. Because we're dealing in a highly acidic environment. And by locking with these inhalers, by locking this acid and sputum into these interstitial areas, it's even more on top of more because cells of the lungs keep producing acid waste. People keep eating foods that are mucosic responsive, which means producing mucus. So all of this stuff fills the sinuses, the voice box, the bronchi, the lungs, but it also fills the bowels, the liver, because you notice when you detoxify, what you see coming out, mucus, 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 at all levels of colors. So your daughter, before she has your grandbaby, you had to fix your daughter because you're not going to like where your grandbaby's going to be. That's not good. And this daughter of yours got to be real careful with any surgeries because that's the problem. If she's already fainting from real low neurotransmitters, imagine going under propofol for this poor thing. Hot is neurological draining. So you want your batteries last longer when you keep them in a cool place. So cool her off. Do not do hot baths. Because get her nervous system back up and running, which means you're going to start at the adrenals and kidneys. You can use brain and nerve formulas, absolutely. And have severe breathing problems. Well, I've been diagnosed since I was 30. Oh my God, man. This is Nathan. My lung efficiency is below 18%, and my FEV1 is 11%. Can you help me? Absolutely, man. Number one, kidney and adrenals. Might sound like a broken record. Kidney and adrenals. Now, why? A couple of reasons. Number one, autonomic nervous system to the lungs. Autonomic nervous system to the lungs. Key, because in your COPDs, it's not just like pneumonia where you're full of mucus. It is neurological. Now, we've talked about COPD before, so you really want to get those adrenals up. And with that probably comes either low or high blood pressure. If it's high, it's just a high is a sign of low, and this is a sign of the kidneys. So you've got to get your kidneys filtering, meaning you've got to bring your adrenals up and your kidneys filtering, cleaning. Therefore, interstitially, and that includes interstitially in the lung, in the wall of the lungs, is going to come clean before those acids create, some of the scarring that's out there. And in scar tissue, you can get rid of scar tissue, but I'm telling you, it is really, really bad. And you've got to get the interstitial fluids in your body hydrated. How you get hydration interstitially means around all the cells is move the acids out that the cells are producing to get that hydration. It's just cell waste going nowhere fast. It's that simple to understand, meaning that the system that's designed to remove cellular poop, cellular acids, is not doing its job. Which system is that? Blood or lymph? Not blood. Lymph, and lymph is tied to the kidneys and the skin. Remember the three eliminative organs of cellular waste and parasitic waste. Essential. So it's essential to get your kidneys and adrenals up. There are some factors. I would also do lungs number 2 myself because it'll help to break up any hardened lung mucus that you can't hear yet that's interstitial. It'll help to break all that up. I would also get aggressive in my bowels. That's all tied together here. These are all branches off the gut tree. Remember, the embryonic tree. So get the GI tract cleaning. Get the GI broom, the stomach and bowels. You got the lymphatic 1 capsules anyway in a detox. Start pulling on that wall. You're going interstitially to get hydration and start moving lymph. Brain and nerve. Definitely use brain and nerve. Number 2, one of them, to start strengthening the myelin sheaths. Very important to go this way, or there's no remedy any other way. And start getting more efficiency that way, man, and you'll do that. Detox yourself. Get in there and do that. And by the way, it'll help, and of course, stomach. This is part of the sympathetic autonomic nervous system, parasympathetic, sympathetic. By cleaning all this, you can even do upper circuit because you're going to get a hold of the parasympathetic as well and the autonomic. So you're going to start resurrecting the whole body as a whole. It's the only way to get well, any of you, holistic, whole body work, not just a little bit here and a little bit there, some vitamins and minerals, wasting your money and time. And you'll get yourself back to wellness, Nathan. And you're too young to live with this. It only gets worse and not good. Are you on oxygen? 2 liters or so, I take it. So work yourself out of this. You can do that. I can tell you, done it with a lot of people. I am a 29-year-old male from the UK. With the help of your teachings and herbs, gland formulas, I have fully recovered from, lifelong chronic asthma and eczema. Oh, good, man. Woohoo! Woohoo! Yeah, baby. You are kicking butt, man. But you know what? Why can't we have our remedies? Why don't we have our, I look around and I see people with confused looks on their faces when you tell them things like this. Well, I didn't know that stuff was curable. You didn't know it was curable? See, I think one of the problem is, guys, is that we have so much medical for so long they can't cure anything. Suddenly nothing's curable and people have lost their hope. And the young people, everybody's lost their hope. They've been to medical doctor after medical doctor. After you pass about 3 or 4 of the guys, pretty soon you're losing hope because everyone pretty much says the same thing. or someone has a different take on it, but it's just a different take on the same spin. So this is good. Good. 5 gold stars, man. 5 gold stars. I was on daily albuterol inhalers. Wow. And you see, he was, listen to this guy. And I have to say, P-R-A-S. Pras? Well, whatever. I have to say, you need a gold star. And not 5 gold stars today, man. Here's the thing. Inhalers, albuterol, well known as a potential cancer causer, because it's not only as an antispasmodic, it locks the sputum in. Well, when you lock acid mucus into the interstitial layers of the lung, guess what starts to happen? Inflammation, swelling, scar tissue can take place, masses can form. I'm just saying. I mean, all these guys, and they don't understand that there is not just there's the neurological event tied here, and it's tied right down to that autonomic and the adrenal glands. And this is what this guy has done. He's fixed his adrenal glands. He's 29 years old. You know he's going to have adrenals, and of course there's the asthma to prove it. He's fixing this so he doesn't have COPD. He's cleaning his lymph, so his lungs are cleaning, his skin is cleaning. Also have mild asthma, normally seasonal. So already, now look at the difference. There's a difference between pneumonia, which is basically mucus and congestion from dairy products and complex sugars and things like that. Once you get your bodies cleaned out, you will know immediately what foods are mucus forming and what foods are not, because you'll get a lot of mucus when you eat things that your body doesn't want. And that mucus has got to either come out, excuse me, or it's going to stay. And nobody likes when mucus hangs around, because then you can't speak very good and you can't talk very good and you've got a lot of breathing problems. But anyway, this asthma, sweetheart, is a neurological connection. It'll take you back to your adrenal glands again and your myelin sheaths and your autonomic nervous system. So the adrenals, and this ties right back to allergies too, and low steroids there as well. So you want to grab into the adrenals, kidneys, you want to start moving that lymph system, clean out the bowels. Get on the endocrine glands. Work on your endocrine glands. Hit the pituitary. Get a picture of your eyes would be a good idea. Look at the transverse bowel and see if that pituitary, see if that's sitting up in a chronic way. You want to go after that. She has an inhaler here, salbuterol. Never heard of that one. You got albuterol, you got all kinds of, most of these have been dubbed cancer causing because they act as an antispasmodic, but they're inhibitors. You want an antispasmodic for all of you that have asthma or some form of COPD all the way up to full blown. I like to use the herbal antispasmodics because they don't have the suppressive action that pharmaceutical inhalers have. So what it does is an herbal antispasmodic will relax the nervous system, feed it a little bit, and at the same time allow you to cough up and get rid of all the congestion. And some of this, the longer you keep this mucus in the lungs, the harder it gets and the more locked in it gets, and the more scarring can occur to the lungs because this is acids. So you want to bring forth an expectoration. Learning how to breathe correctly is vital as well. You notice if you start deep breathing enough, you'll start to cough up some mucus. So we know that oxygen and carbon and all that helps to break up mucus. So remember, don't breathe thoracically. We've talked about this before. Breathe abdominally. When you take your first breath, you want your abdominal muscle to move. You don't want your shoulders to move or thoracic to move. You want your lower abdominal muscles to move. So when you take your first breath, you want to go like that. You want to pull it into the lower lobes by breathing down in the abdominal area. And then you can go like this. You can go first, which breathes here, and then you're taking your next, and huge, you're full. All lobes are full. 3 on right, 2 on left. But you want to go after those adrenal glands in all these cases, especially with any COPD, because there's your little problem in terms of the neurological feed to the adrenals. So you really want to get your kidneys and adrenals back in order, start cleansing, clean up the GI tract, and then you're going to have a healing crisis in the lungs. And you're going to feel like you got pneumonia, and you're going to spit up a lot of mucus. Going to go from clear to yellow to green to probably brown and black if you dig deep enough. Now you're going to get stuff out of you, especially the smokers and all. You're going to get black tarry stuff out of the lungs. You're going to get rid of a lot of nasty stuff, and you don't have to be a smoker to get out the black tarry stuff out of the lungs. But most of those that are do get the black tar thick stuff out of the lungs. Seen it a lot. And that's what you want, though. When you start getting this black tarry stuff out of the lungs, you start realizing what's up. You start going, whoa, 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 wait a minute here.